Joining us live now is Dr. Ann Liu, an infectious disease physician at Stanford Health Care. Thank you so much for joining us. First things first, there's been a lot of talk about whether everyone will need another COVID shot. The CDC recommending a third dose for certain people. So how do you know if you're eligible and why?
So this is something that just came out yesterday, that people who have compromised immune systems should get a third dose of an mRNA vaccine. So people of any age can be immunocompromised for many reasons, including being on medications to suppress your immune system, such as transplant patients or those with significant autoimmune conditions, getting certain types of cancer treatments, having a genetic disorder that weakens the immune system, having untreated or advanced HIV infection, and several other conditions. Many people who are immunocompromised do not produce high levels of antibodies against SARS-CoV-2 after a COVID-19 vaccination, the way we see with people with normal immune systems. Some don't produce any antibodies at all. Antibodies seem to play some kind of protective role after vaccination, although they're not the only part of the immune memory. So the data for third doses for mRNA vaccines is primarily in people who had solid organ transplants. So that's people who had heart transplants, kidney transplants, lung transplants, and so on. And it showed that people who have had transplants, some actually who don't have that many antibodies before the third dose, when they get a third dose, boost a lot. But some actually didn't boost at all. So not everybody within this group will respond. So as far as knowing whether you fall into one of these groups, the CDC will be releasing that information, and then it will be up to local vaccination sites to determine how they're going to distribute that. Are they going to require a letter? Are they going to have people self-identify if they're immunocompromised? But generally speaking, this will encompass people who have had some kind of organ transplant. This might include also bone marrow transplants, people who are actively undergoing cancer treatments that might suppress their immune systems, people who are living with HIV that is either advanced or not yet treated, people who have certain types of autoimmune conditions for which they're on immunosuppressive medications, really significant ones. And then people who have primary immune problems, such as people who are born with problems with their immune system. And there will probably be a couple other categories, but that's the bulk of the people who will be covered under this emergency use authorization. And they estimate that makes up probably just under 3% of the population.
Right. Very helpful information. So a lot of people don't panic right now and go and double up. Just wait for the advice from your doctor. So thank you on that one. Let's talk about the Lambda variant and what is known about that. Here we're going from the COVID to Delta to Lambda.
Yeah. And there's so many letters in the Greek alphabet, and hopefully we won't get to all of them, but the Lambda variant was originally detected in Peru and then has been spreading across South America. It seems to evade some of the vaccines that were being used there. We don't know yet whether Lambda will get much of a foothold in the US while Delta is around, and whether the vaccines that are being used in the US will be less effective against Lambda. That is to be determined. There's some information coming from lab studies that don't involve actual humans, but a lot of that is very preliminary. Delta has been outcompeting Lambda so far and spreading across the world, probably because Delta is so much more contagious. But we have yet to learn much more about Lambda.
All right, we won't get to that point, but it's good to know. And Dr. Ann Liu, thank you so much for your time. Thank you for joining us, and hope you have a nice weekend.